Dr John Puntis, co-chair of Keep Our NHS Public. Good morning to you, John.
Hello, Matthew.
I'm not so sure I agree with the Joseph Rowntree Foundation. This is not a sign that people have given up faith in the NHS. I'm starting to feel that this may be a sign they are giving up, losing faith.
Well, we should remember that when properly funded, the NHS was one of the best services in the world until about 2017. And it's now slipped down those international rankings for two main reasons. One is difficulty accessing care, and the other is management. And I think, the key thing is if you're going to invest in the NHS to make it better, things will improve. If you're going to invest in the private sector as an alternative, then you end up with a two-tier system and what Wes Keating has described as a poor service for poor people. But actually, before the election, the cost of living crisis was number one concern, closely followed by the state of the NHS. And lots of surveys showed that people overwhelmingly supported the founding model of the NHS.
Yes.
Wanted a comprehensive service funded out of taxation that was free at the point of need and was publicly delivered. And politicians, I think, need to listen to the public. It's no surprise that if you're running down services and people can't get treatment, that they look at whether they can pay for it.
Absolutely.
Many people cannot afford to pay for treatment. And if you are going to shift the financial responsibility for healthcare onto individuals and families, it inevitably increases health inequalities, which is one of the strong arguments against it. The Joseph Rowntree research is interesting, but £200, as a gentleman said, will get you nothing. I get you a consultation. That's not terribly helpful. Many people simply could not afford £30,000 for a hip operation. They can't even afford to see a private dentist. So we're not talking about something which is within the grasp of the vast majority of the population to pay for their care. And I think the rational model for the NHS remains the one based on its founding principles. There's no question about that.
Can I ask, John, is there a moment in history where the founding principle was undermined and thereafter the door was ajar? I mean, I was looking back over the history of the NHS before I came on air, and charging for dentistry, I think it was 1952, I think the first charges came in. That's the first time that people were asked to pay, and not long after the NHS was set up, really. Is that the moment which gave the politicians the sort of the opportunity to say, oh, well, if they're paying for that, they can pay for this, they can pay, and then drip feeding it over the decades, we pay for more and more?
Well, in a sense, historically, that's right. And of course, dental charges then went up nearly every year. You had charges for eye tests introduced, charges for prescriptions introduced. Yes. But having said that, the charging was very limited for many years because there was really a cross-party consensus over the NHS until the Thatcher years, I think. And then we've seen an acceleration in terms of the involvement of private companies.
Agreed.
And then the Alan Milburn Concordat in early 2000s when the NHS was told it had to refer simple patients to the private sector for treatment.
And I can't help but think when you have a directive from government saying go private, it's only going to feed the fire of ordinary people thinking, oh, well, we may need to consider going private at some point ourselves. Dr John Puntis, always a pleasure, and all strength to you at Keep Our NHS Public as well.